Welcome to the Bernade channel. Thank you for joining us. In this comprehensive guide, we'll explore the fascinating phenomenon of hiccups, their causes, mechanisms, treatments, and when they might indicate a more serious condition. What are hiccups? Hiccups, medically known as synchronous diaphragmatic flutter, SDF, are involuntary contractions of the diaphragm muscle. Each contraction is followed by a sudden closure of the vocal cords, producing the characteristic hic sound. Hiccups can occur individually or in bouts, and while usually harmless, they can sometimes be persistent or indicate underlying health issues. The anatomy of a hiccup. 1. Diaphragm, the primary muscle involved in breathing, located at the base of the lungs. 2. Phrenic nerves, these nerves control the diaphragm's movement. 3. Vagus nerve, this nerve plays a role in the hiccup reflex. 4. Glottis, the opening between the vocal cords that closes during a hiccup. 5. Intercostal muscles, the muscles between the ribs that contract during a hiccup. Common causes of hiccups. 1. Eating habits, eating too quickly or too much, swallowing air while eating or drinking, chewing gum or sucking on candy. 2. Dietary factors, consuming spicy foods, drinking carbonated beverages, consuming very hot or very cold foods/drinks. 3. Lifestyle factors, smoking, drinking alcohol, sudden excitement or emotional stress. 4. Medical conditions, acid reflux or GERD, tumors affecting the diaphragm, brain disorders affecting the respiratory center. The physiology of hiccups. 1. Nerve stimulation, irritation or stimulation of the phrenic or vagus nerves can trigger hiccups. 2. Diaphragm contraction, the stimulated nerves cause the diaphragm to contract suddenly. 3. Air intake, this contraction causes a quick intake of air. 4. Glottis closure, almost immediately, the glottis closes, stopping the inflow of air. 5. Hic sound, the sudden closure of the glottis produces the characteristic sound. 6. Reflex arc, this process is believed to be controlled by a reflex arc in the brain stem. Types of hiccups. 1. Acute hiccups, last less than 48 hours. 2. Persistent hiccups, last more than 48 hours but less than 1 month. 3. Intractable hiccups, last more than 1 month. Each type may have different underlying causes and may require different treatment approaches. Home remedies for hiccups. 1. Breathing techniques, hold your breath for 10 to 20 seconds, breathe into a paper bag for a short time, practice deep, slow breathing. 2. Drinking methods, sip cold water slowly, drink water from the opposite side of the glass, gulp water while holding your breath. 3. Eating remedies, swallow a teaspoon of sugar, eat a spoonful of peanut butter, suck on a lemon wedge. 4. Physical interventions, gently pull on your tongue, apply pressure to your diaphragm, perform the Valsalva maneuver, try to exhale while closing your mouth. And home remedies for hiccups. Pinching your nose. Medical treatments for persistent hiccups. 1. Medications, chlorpromazine, a antipsychotic that can help with hiccups, baclofen, a muscle relaxant, gabapentin, an antiepileptic drug also used for nerve pain. 2. Procedures, nasogastric tube insertion, can sometimes stop persistent hiccups, phrenic nerve block. In severe cases, this surgical procedure may be considered. When to see a doctor. Consult a healthcare provider if you experience 1. Hiccups lasting more than 48 hours. 2. Hiccups interfering with eating, sleeping, or breathing. 3. Hiccups accompanied by severe abdominal pain, fever, or vomiting. 4. Hiccups causing significant distress or affecting your quality of life. These symptoms could indicate an underlying condition that requires medical attention. Interesting hiccup facts. 1. Fetus hiccups. Hiccups can begin in the womb, as early as the first trimester. 2. Record holder, Charles Osborne had hiccups for 68 years, from 1922 to 1990. 3. Animal hiccups. Many animals, including cats, rats, and horses, can get hiccups. 4. Evolutionary theory. Some scientists believe hiccups might be an evolutionary remnant from our amphibian ancestors. Preventing hiccups. While not always possible, you can reduce the likelihood of hiccups by 1. Eating slowly and chewing food thoroughly. 2. Avoiding carbonated beverages and overeating. 3. Managing stress through relaxation techniques. 4. Maintaining good posture while eating. 5. Avoiding sudden temperature changes in food and drinks. Important notice. This presentation is for informational purposes only and should not be considered medical advice. For personalized medical information and answers to over 3,000 health-related questions, download the BurnAid app for free from the Play Store or App Store.